And they may
Mhm.
say, oh, I had them checked at my previous doctor. He or she checked them, 2 months ago, and I was told they're all normal. But I still
Yes.
feel really sluggish. I'm having
Mhm.
issues losing weight. I'm having hair changes. What would
Yeah.
you like this is your focus, this is what you love. What would you like those women to know, and me as the family doc, to know
Sure.
about those labs coming back normal, but maybe they're not truly actually normal.
Maybe
Maybe
they're
this
not
still is
truly
a,
actually
a
normal.
thyroid issue. Yeah.
Yeah, so that's when I talk to doctors, that's the lecture that I give is what do you do when normal TSH isn't normal?
Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey, ladies, welcome back to today's episode. I'm so excited to be joined by Dr. Dana Gibbs, who's an ENT physician, so an otolaryngologist, right? Did I get that right?
Yeah,
That's such a
that's
hard
right.
word to say. Dr.
Just
Gibbs,
say
welcome to
ENT.
there. I know it's so much easier for me. So in my daily practice, it is absolutely ENT that I say instead. It is great to have you here. I know that you are in Texas, right? And you have
Yes,
a direct care practice, and your specialty, your jam is thyroid disease. Will you
that
tell
is
us a
absolutely right.
little bit about you, just if you'll introduce yourself a little bit more and tell us where your love for thyroid disease comes from?
Yes, yes, absolutely. Well, hi, thank you for having me. This is so cool to be on. So yes, I'm an otolaryngologist, and people don't think about that thyroid surgery is part of otolaryngology, but that's a big part of what we learn in our basic ENT training, is how to do surgery on people's necks, and thyroid's a big part of that. So I started, doing thyroid surgeries in my practice. I mean, I got out of residency and I started doing thyroid surgeries in my practice. And it was funny because the patients would come back after their either partial thyroid or total thyroid, and they would feel terrible. I mean, terrible. Gain 20 pounds, 30 pounds, 40 pounds, can't stay awake, can't stay asleep, freezing all the time, all these symptoms. And we'll go over those more in a minute. Um, and I would say, well, did you go back to your endocrinologist? Did you, and they would say, yeah, the endocrinologist says everything's fine. And they're not fine. These people are
Hmm.
not fine.
Hmm.
And so I started trying first to do whatever I could not to have to do that surgery on people. It's like, look, if your biopsy, if your needle test that you have for your thyroid is looks benign, or it's possible that we don't have to do this surgery, let's not do it. Let's put
Hmm.
you on something that will stop that thing from growing. Let's keep you from needing that, because the minute you get that thyroid surgery, you feel worse. And that was my initial, that was like 2 years out into residency, really, really early. And then something happened that really just blew my lid off. It was a conference that I went to where they were mostly talking about allergy, but I felt like, oh, I know all this stuff. And so I'm going to go into this other room over here and I'm going to learn about thyroid. And the guy put up this list of symptoms, big long list of all the symptoms that you get when you have low thyroid. And I read that list and I was like, holy cow, I have all those things. I have
Ah.
all those things. And then the next thing he said was, you don't have to have abnormal TSH to have those things and you can still take medicine and feel better. And I'm like, what? What are you talking about? So
Uh-huh.
I went to him and I said, what is it? What do I take? He told me, he taught me. And so when I took that medicine and all of a sudden all those symptoms went away, I was like, what is going on here? And I started
Right.
looking and looking, and I finally found a mentor that could tell me why. And funnily enough, he was an ENT doctor too. And
Mm,
he had
hmm.
Hashimoto's disease. And so he had been through all of this himself as well. And so I started doing what he told me to do for my patients. And it's funny how many people who end up in an ENT doctor's office have thyroid symptoms,
Hmm.
because they're sick all the time. And that's one of the things that happens if you have low thyroid is that you can't fight off an infection. You
Right.
look like you're allergic all the time. And once you get your thyroid under control, a lot of that'll go away.
Right.
The one that really brought it home to me was I was treating this teacher, and it was, January, and she was sick and her sinuses were awful. And I treated her the way I always treat people, with long courses of antibiotics and steroids and all the things. She came back and we did her scan and it looked awful still, and I'm like, you need surgery, you need sinus surgery. And she's like, well, but I can't do it until school's out. And I'm like, okay, it's March, it's not that long, fine. um, and then the funny thing was summer, and I said to her at the time, I was like, you got a couple things that make me think you might have thyroid. We did the labs, I put her on the thyroid medicine, and then she didn't come back. She didn't come back and she didn't come back. And then right before school started again, she came back. And I was like, well, now we don't have time to do your surgery. And she's like,
Right.
oh, I don't need that surgery anymore. I'm all well. I just need a refill on
I just
that
need my
thyroid
refill.
medicine.
I love it.
What? What? And we did her scan again and it was all gone.
Oh, wow.
And
Yeah.
it was like,
Like,
oh, I really
I'm on
figured
to something
something else
here.
here.
Uh-huh.
And, I kept trying to send people back to the endocrinologist, and they kept saying, oh, no, their TSH is fine. They're fine. Go away. Patients felt terrible. And so I
Yeah.
have to learn this. I
Yeah.
have to learn
Absolutely.
this. And I
Absolutely.
did. And the more I did that, the less times I did surgery. And the less times I did surgery, the more I got a rep for fixing people's thyroid without surgery.
Hmm.
And so eventually I was like, I don't need a surgical practice anymore. I'm just treating people with thyroid problems,
Right. Right.
and if I find somebody who actually needs the surgery, I've got a really good surgeon I can send them to.
Hmm.
But I'm only doing that once a month, and that's not long. That's not enough to really keep your skills sharp. You need to
Right. Right.
do a thyroid surgery a week or more to keep your skills sharp. And so I said, you know what? I'm done doing
Hmm.
surgery. And
Hmm.
then I'm going to open this other practice. So here I am.
I love that. And think
Here I
about how much
am.
of an impact you made on patients' lives, right? By not sending them straight to the OR, right? And not
Right.
directly or immediately operating
Right.
on those patients. Because
Yeah.
you are so right. I mean, I've seen it so many times just as primary care docs, family medicine, patients feel pretty crummy after getting the
They
surgery.
do. They unless they find somebody who knows what I know and can
Hmm.
get their thyroid hormone properly balanced. But when you don't have a thyroid gland anymore, you don't make thyroid hormone, you don't release thyroid hormone into your body continuously all day long, and you feel terrible. And that brings up, maybe we ought to talk about, okay, what is thyroid hormone? What is it?
Yeah, if you don't
Okay.
mind, let's go right into that, kind of what the thyroid does, why it's important, especially for us as women and just what that does in our body.
Yeah, yeah. Okay, so thyroid hormone comes from your thyroid gland, which is right above your collarbones in your neck on either side of your windpipe. Thyroid hormone is kind of the gas pedal a little bit. It's kind of the driver of energy production in your body. It controls the way your body makes and uses energy. It controls the synthesis of all the different proteins your cells need to grow and regenerate and stay healthy. It drives a chemical called ATP, which is the
Mhm.
little energy cell packets that are in your mitochondria. And it drives the functions of a lot of different tissue types, like your GI tract, like your brain function, like
Right.
your sleep. like your body temperature. It's like if you don't have thyroid, you can't even stay warm. Do your muscles work well and feel good? Do you have acceptable or healthy immune function? It's does your skin grow and turn over? Does your hair grow and turn over appropriately? There's so many things. And then, of course, weight gain.
Right.
Everybody seems to know about thyroid and weight gain. But the funny thing to me is that a lot of the people that I see don't even have the weight gain. I didn't.
Mm-hmm.
A lot of people do, but a lot of people don't. And so, one of the things that I thought wrong when I first started doing thyroid was that you have to be overweight to have a thyroid problem. And it is
Yes.
not true.
Right. Absolutely not. Mm-hmm.
Yeah.
And so you mentioned earlier, and I want us to dig into this a little bit because it happens so often that, patients will come in to whether I'm drawing their labs and I see labs that are normal, or if they're a new
Mhm.
patient to me and they're giving me all the things that make me say there's something off about your thyroid here.
Yes.
So whether women come in and, they're telling me these things and I say, when's the last time you got your thyroid levels checked? And they may
Mhm.
say, oh, I had them checked at my previous doctor. He or she checked them 2 months ago, and I was told they're all normal. But I still
Yes.
feel really sluggish. I'm having
Mhm.
issues losing weight. I'm having hair changes. What would you
Yeah.
like this is your focus, this is what you love. What would you like those women to know, and me as the family doc, to know
Sure.
about those labs coming back normal, but maybe they're not truly actually normal.
Maybe
Maybe
they're
this
not
still is
truly
a,
actually
a
normal.
thyroid issue. Yeah.
Yeah, so that's when I talk to doctors, that's the lecture that I give is what do you do when normal TSH isn't normal?
Mm-hmm.
And so there's a set of 5 labs that I draw, and the TSH is one of them. And maybe we ought to say what TSH is, because
Mm-hmm.
TSH is not even thyroid hormone. TSH
Uh-huh.
is something called thyroid stimulating hormone, and it is a chemical that's made in your pituitary gland, which is part of your brain that goes to your thyroid and says, hey, we need more, make more. So the higher that number is, the more it's trying to push your thyroid to make more, make more. We don't have enough, make more, make more. And so when I see somebody come in and their TSH normal range, as the labs report it, is about 0.5 to about 4.5. So it's a 10x difference between
Mm-hmm.
low and high.
Mm-hmm.
And if I see somebody and they say, I have these symptoms and they list them out, and their TSH is above about 2, so about halfway up that range, I'm suspicious. I'm like, okay, something's wrong. But I have seen people whose TSH was completely and utterly fine in, 1 or less than 1, and still they have those symptoms. And so that's only the first test that I do. The next 2 tests that I do are the free hormone levels. So you have T4, which is what mostly comes out of your thyroid gland, but it's not the one that does all the work. That's just the one that flows around in your stream and kind of sits there and waits for when it's needed. The next one is T3, and that's the one that does the work. 99% of the work is done by T3. And the problem with a lot of medical conditions is that it impairs your ability to make enough T3 from the T4 you have. And so it's possible to have enough T4 and enough TSH, or a normal looking T4 and TSH, and not have enough T3.
Mhm. And that usually is what happens when that maybe a doc has checked a TSH and a free T4 and said, "Hey, your labs are normal," but these women
Right.
still
That's
feel well,
exactly
right?
right. Because those are the 2 tests that almost everybody
Hmm.
does, and no more than that. That's
Right,
all they
right,
do.
right.
Um, so the next, yeah, so the T3 being the active one, in order to grow hair, in order to grow your fingernails, in order to have healthy skin, in order to not be constipated or have GERD, in order to have normal menstrual cycles, in order to have normal blood pressure. I mean, you wouldn't even think normal blood pressure is dependent on whether you have an adequate amount of T3 thyroid hormone. Normal immune function, joint and muscle pain, icy cold hands and feet, comfortable sleep without night sweats. all of those things. And then mental issues too,
Mm-hmm.
because
Mm-hmm.
even though all those other symptoms that I just said, and it's cholesterol and it's weight gain and it's your face gets all puffy, but mental stuff tends to be the number one thing that people feel when they
Right.
come to me.
Right.
They're
Mm-hmm.
they're tired, they're anxious, they're depressed, their memory is poor, they have trouble making decisions. I mean, they feel terrible. They feel
Mm-hmm.
terrible. So I do another set of two tests. I do the total T3 and the reverse T3.
I want to break right here because you have a really cool program that's coming up that I may need to be a part of this program too. But I want to pause here and
Sure.
share it with my listeners because it really gets to what you're starting to talk about now, right? Is how to take into account those symptoms that people may be
Yes.
having and then what to do with those, what to ask your doctor for, how to
Yes.
act on those numbers, what should be expected. So I have a lot
Yes.
more questions for you, but because I think we're right there at it. Tell us a little
Yeah.
bit about this program that you've got upcoming, Dr. Gibbs.
Okay. So this program is going to be a program for anybody who wants to join, who wants to know
So
if
not just for
they're
doctors.
not just for doctors. No, this one is for anybody who wants to know whether thyroid function is normal in the way that I check thyroid function. And so what it is you come in and the first week we talk about those labs that I just said.
Hmm.
And I teach people what to ask for if they're going to go to their doctor and get those labs. And if they have tried their doctor and their doctor's like, oh no, I'm not going to do this, then I'm going to teach people how to go to one of these do it yourself, order them yourself, kind of pay for it yourself kind of labs. And they're not ridiculously expensive. You ought to be able to get that set for less than $150. Then how to order them. You go to the place, you get them drawn, and then it takes, you wouldn't think, but it takes about 10 days for those labs to come back. And so the second week, what we're going to talk about is those symptoms and how to recognize them and things like what kind of supplements are helpful, what kind of supplements can be harmful, because there's a lot of them that can be. The third week, we're going to talk about what do those labs mean, because everybody should have them back by then. We're going to talk about exactly what do these labs mean, and I'm going to walk people through step by step. Okay, this number means this. Okay, now look at the next one. Well, that means this. And I'm going to go through a step. By the end of it, you'll know, okay, is it too much? Is it not enough? Is it too much of this, but not enough of that? Or is there something else going on? I'm working on this is kind of the sticking point for me, is making this part as simple as humanly possible, because it is a lot.
Hmm.
It is a lot. It's not impossible, but it is, if you're one of these people who looks at, your checkbook and goes, "Oh, I can't do it," then you might have trouble with this. But truthfully, it's going to be, if this number is above this and below that, here's what you do. If it's above
Hmm.
that, then here's what you do. If it's below that, then go to step 2, go to
Hmm.
step 3, go to step 4, and at the end you'll know I have too much of this, not enough of this. What do I do next? And
Hmm.
then the final week, we're going to talk about how to figure out what doctor to go to, how to talk to your
Yes.
doctor about how to get what you need.
I think
Um,
that's wonderful. And I think, and I can, speak freely with you. I think that you may get some folks saying, "Hey, Dr. Gibbs, my doctor said she doesn't know what these numbers are, what these labs are. Can I just
yeah,
come see you?" And I think that that may happen and may
yeah,
happen just because of what you said earlier. I think we are
yeah.
conditioned in our training. You get that
Mhm.
TSH, you get that free T4. If they're
Yeah.
normal, the patient's fine. Go find something else that could be the cause of it. And so folks may get a little bit of resistance from their docs, but this is why this type
Mhm.
of education for patients is so important. So I think that
Yeah.
this course that you're planning is such a great idea. It's a way to empower your patients.
But then when you go to an endocrinologist these days, they are so busy and so overwhelmed with diabetics that they don't, a lot of them are stopping seeing thyroid patients.
That is very real,
I
and I
am
think that that
shocked
certainly
by
is real.
that.
Hmm.
They will not see you unless you have an abnormal TSH. And I'm like, but there's so many people who need you. So, and that's not every endocrinologist.
Right, right. But
I'm not,
it
I don't
certainly
want
is.
to, yeah,
Right.
I
We
don't
won't
want to badmouth
generalize, but they
endocrinologists,
certainly are out
but
there.
I
Absolutely.
heard another one this, like a couple of days ago. My endocrinologist won't treat me. And I'm like, what?
Yeah, I
Holy
hear it
cow.
quite often. So you certainly
Anyway,
certainly have your work cut out for you there in
yeah,
training both physicians and
yes,
patients to be advocates for themselves and physicians to just get a little bit more comfortable with treating the things that we know are right in front of us, that we
yeah.
just hadn't put our fingers on yet because we haven't checked the right test.
The mailing list to get on the mailing list for this program is my name, danagibbsmd.com/, and the word checkup. danagibbsmd.com/checkup. And I know you got a lot of listeners that are probably interested in this. It's not going to be a
Absolutely.
high
So
price thing because, like I said, I want to teach anybody.
Well, I'm so appreciative of the work that you're doing. So danagibbsmd.com/checkup. And ladies, if you're
Correct.
driving or out for a run or walk, don't worry, you don't have to stop and write it down. I will tag this in the show notes. And so if you'll check out the show notes for this episode, the click link will be there and it'll take you right to it. I think that this is a wonderful topic for a course, and I know that you are going to reach so many people and really help so many women who, or people just in general who have been struggling with these symptoms who keep getting a everything's fine answer.
Yes, absolutely.
Absolutely. So I wanted to ask a little bit about kind of the signs and symptoms that people have, and you've already gone over that for us a little bit. Would you
Yeah,
mind just recapping, if your thyroid level is high, maybe what kind of symptoms you may have, or if
sure.
that hormone's low, just so women can start to maybe separate those two, whether numbers are high or low?
Sure, sure. Well, unfortunately, that's a little more nuanced than you would think. Sometimes the symptoms of a little too much are almost exactly the same as not enough thyroid, which
Hmm.
is the fatigue, sluggishness, difficulty with sleep, poor quality sleep. And then a lot of people complain of what they call brain fog.
Hmm.
And brain fog to me just means your memory's not as good as it ought to be. It takes a long time to make a decision. Your executive function, your grasp of concepts is much slower than it would ordinarily be. And then you could be depressed or anxious as well. Um, and I have seen it be that someone is so depressed, so anxious that they just can't even grasp, but that they need to look at
Yeah.
this or start with this because it's just like I'm paralyzed and I can't move. And that's common with low thyroid.
Right.
Um, the next one is feeling cold. Particularly, people will say, "Oh, I'm just cold natured."
Hmm.
That happen all the time. You come in, you shake their hand, you're like, "Woo, your hands are cold." That was me. My hands were freezing, and I'm like, "Oh, I'm just cold natured,"
Right.
until I
Uh-huh.
wasn't. It was
Right.
like, "Oh, it went away." Boom. I'm like, "Oh, okay."
Does not
So
have to
this
be the
is
normal.
definitely a symptom. And then the muscles and the joint pains, the poor immune function, the increased allergy symptoms. People who
Hmm.
say, I have allergy, and you send them for an allergy IgE test and nothing comes back, think thyroid. Think thyroid. Low blood pressure, palpitations, slow heartbeat, low body temperature. If you take their temperature and they're 96 point something, think thyroid. Infertility, inability to conceive and or repeated miscarriages is much calmer than is more common than you would think. About half of people with low thyroid will have irregular periods or super painful periods, and they can be too long and then too short. And then constipation, very common to be
Hmm.
constipated
A
or
lot.
bloated. Another common presentation is losing hair, like not just in the front like a man's hair loss, but losing hair kind of thin all over the top of your head to where you can look through somebody's hair and see the top of their scalp. And then also losing the sides of your eyebrows.
Oh, now that one I'm
And
not
that's
all about understand.
really specific. If somebody comes in and they have the inner parts of their eyebrows and the sides of them have faded off, And it's hard. You have to look carefully because a lot of people pencil them in.
Right. Yeah.
But if you're like, did you pluck them or are they really just gone? And
Mhm.
it's if they say they're just gone, that's thyroid.
That's good. I'm gonna have
Um,
to remember that one. I was not familiar with.
yeah. And then of course, metabolic syndrome and weight gain. And that's
Right.
the last one.
Absolutely.
And you can tell people to eat better and exercise more, but if they're too tired to get off the couch, it ain't gonna happen.
Right. Let's fix the
Yeah.
thyroid first.
Fix the
Absolutely.
thyroid
Absolutely.
and then tell them to get off the couch once they're feeling better.
In my experience, and this may not be right, so I would love for you to give your experience also, but I find so much more thyroid disease in my female patients.
Absolutely.
And so, one of the things that I want us to have as a takeaway from for our listeners in closing is how would you encourage our female listeners to approach this topic with their primary care docs, with their,
Hmm.
endocrinologists, even if they're seeing them already, or at what point do you
Hmm.
say, all right, I need to find somebody like Dr. Gibbs who can help me out? So just in general, how would you encourage women to approach this?
Well, first of all, let's talk about why it is. Why is it that women
Hmm.
have literally 10 times as much thyroid disease as men do? And it's because women disproportionately get something called Hashimoto's disease.
Hmm.
And Hashimoto's disease is an autoimmune disease that attacks your thyroid gland, kind of damages it. And it's not the only autoimmune disease, but women are more susceptible to autoimmune disease in general, all across the board. Women are more susceptible to autoimmune disease. And we think it has to do with the fact that women have hormone cycles. I mean, our estrogen cycles up and down. Our testosterone stays high till we're like in our 30s and then it goes down, down. But estrogen up, down, and sometimes it's really low and sometimes it's really high. The most common time to get Hashimoto's disease, to have a rapid onset of, oh my gosh, I have symptoms now, I've never had them before, is right after you deliver a baby.
Hmm.
Um, but it can also happen during puberty when all of a sudden you have hormones where you didn't before. It can happen as you go through perimenopause where your hormones are
Right.
all over the place.
Right.
And
Yes.
so we really, really think that has a lot to do with it. And so that's, I don't know, it's the curse of being a woman, I guess. It's the privilege of being a
The
woman. How about I
privilege. There
say
you
that?
go.
Is that we have to really watch our levels. So yeah, so this list is pretty long of things that you can do. Um, and I start with, look, don't let yourself get overwhelmed by this idea that I'm not everything I can, because nobody can. But can you eat better? Yes. Can you eat more protein and less bread? Yes. Can you multivitamin each day? Yes. Can you really work to get your sleep on a regular schedule so that you're not constantly sleep deprived? Yes, that's all those things are helpful. And if you still have all those things, go have somebody do a Hashimoto's antibody test on you and see if you have it. So
Mhm.
that's really, really important to do. If people want more information about all of this, I do have a podcast
I
that I
love
will
that. Tell
let
us
you
about
know.
your podcast.
So my podcast, I just did episode, I think 32. It's called Beyond the Thyroid. The
Hmm.
goal of the podcast is to go into all hormone topics eventually, but right now I've really been focusing 90% on thyroid only.
Yeah, because there's so
Um,
much there, right? I feel like you could do the first 100
I
episodes on
I thought,
thyroid.
oh, I'm gonna be done with thyroid in
Yeah.
10 episodes, and I just keep finding more and more things to
Yeah,
talk about.
I
So
love it. And I
anyway,
love the way you explain. I think it's so interesting. And again, it's so important for patients to, be great advocates for themselves and for us as
right.
docs to be better advocates for our patients. So great.
Yes,
Any closing thoughts
absolutely.
from you, Dr. Gibbs? I want to make sure again that everyone knows I'm going to link her podcast in the show notes, and that course that she mentioned earlier again can be found at danagibbsmd.com/checkup. And that
That's
does
it.
sound like a treat of a course. Now, this is going to air in August, and the expectation is that that course will be when, Dr. Gibbs? Just in
So
case they listen to it.
I plan to start it at the very end of August. and
Perfect.
it'll run
Gotcha.
for 4 weeks. But I'll run it again. So if you
Oh,
hear
great.
this later, go ahead and go to the link and sign up. I am going to run the course again over and over again.
Love
So,
that.
oh,
Wonderful.
yeah, yeah,
That's
yeah.
wonderful.
Final thoughts are, I just want to reiterate what I said before, is taking care of your health, the basic pillars, the basic concepts: eat right, sleep, exercise, take care of your mental health by having community around you and by taking time for yourself. So those things are crucial no matter whether you have a health problem that you are struggling with or whether you're just tired
Hmm.
like I was. I mean, I didn't know I had a health problem until I saw that list. So, and I was already a thyroid surgeon and I didn't know.
Well, Dr. Gibbs, it has certainly been a treat to have you today. I certainly myself have learned so much from you, and I'm sure that our listeners have also. Please do plan to check out Dr. Gibbs' podcast. Again, I'm going to link it in show notes, and we'll link just more information about where you can find her in general. Ladies, I hope that you learned a lot in this episode. We'll be back next week with another episode as we are all on our path to becoming healthier. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.